what did I tell you, passion and sincerity. Our keynote speaker for today, this afternoon, is Jacqueline Scott, a senior program director at the National Academy of State Health Policy. Before joining the Academy, Jackie served as a fellow and adjunct professor at the Harrison Institute for Public Law at Georgetown University Law Center. There, she was the co-director of the National Center for Sustainable Health Outreach, the first national center dedicated to advancing the CHW workforce. She currently focuses her work on public health law, children and family law, and race and gender equity. Let's welcome Jackie.
Good afternoon, everyone.
Good afternoon.
I always joke and say when I started all this work, I didn't really have to put on my glasses to read what I was going to say, but I still need to put on my glasses so I can see folks in the back. It is indeed a pleasure to be with you this afternoon to share in this tremendous day of conference, but also this tremendous celebration of the achievements. Just listening to Sergio and Jacqueline tell the story, and we were sitting at the table reminiscing about how we've come full circle, Jacqueline and I, in our work together, and talking about and dreaming about all the different things that the CHW workforce could become and should become as an integral part of our healthcare delivery system. So it is just tremendously exciting to be here. And I have to tell you with full disclosure that ever since Sergio called me and asked me to do this, I've had a sense of trepidation and a bit of nerves because this is so much of who I am and who I've become over I don't know how many years now that we've worked together. And community health workers, you, the workforce, is so near and dear to me that I struggled about as I thought, what will I talk about? I wanted to say something that was so interesting and profound that everybody would sit back and say, wow, that was deep. She really gave us something to take away, from this conversation that I didn't know. But the more I began to read and the more I began to talk to people and the more I began to sit back and reflect on the documents that Sergio shared with me that the initiative had put forth in their recommendations, I really was struck by the sheer comprehensive nature, the targeted and focused approach that had been engaged in over the last few years, particularly, to come up with the kinds of recommendations that were put before you in that document. And I just say I truly congratulate you for that. That is tremendous, and it is a tremendous guidepost now from this day forward to move into and beyond. So I thought, you've probably read a lot, you've probably heard a lot, and you've probably, seen the research in some of the studies and certainly have heard the wonderful stories. So maybe we shouldn't spend time on that. Then I began to look back and say, what do I know about what's happening across the country and where you fit in here? There are currently probably 20 to 25 states that currently have one or more CHW coalitions, organizations, or networks in them. And when you look at them, some of them are very small and very rural regions of the country, like the Mississippi Delta, and they range from that sort of small rural kinds of communities in Texas and Arizona and New Mexico, to very large, progressive, advocacy-oriented, action-oriented networks like yourselves in places like the city and in Rochester and in Massachusetts and Maryland and lots of places, California. So there's such a broad range there. And, you know, there have been lots of stops and starts to those networks, but for the most part, they are making great progress. There are states that have implemented isolated policies to deal with workforce strategies for the community health worker workforce, and that have also tried to deal with financing strategies. But a number of them have had modest impacts. And I often reflect back and I say perhaps that's because they've decided to target very specific populations or very specific diseases to begin with. Now, don't get me wrong, I know that we must start somewhere. And I know that and very much appreciate where those programs have started. Because where those initiatives have started, they have leveraged the opportunities that exist today. These programs have done a great deal to show a lot of promise for designated interventions and have had successfully been able to work with foundations to secure funds to move those initiatives forward. But it actually has been difficult to take those programs and translate them into larger scale, comprehensive, sustainable workforce models, which is the future of where we're all trying to go. So I would suggest to you today that those places, those coalitions, those states, those networks that are gaining the most success will be those that over time look to develop comprehensive policy and system change together as they move down the track of growth. And the critical piece of that is time, that this happens over time and in collaboration, systems and policy change. A comprehensive strategy that has the best chance to build capacity of integrated and sustainable CHW workforces, in my opinion, include 4 buckets. What are they? The first is a financing mechanism. How will you pay for what you are trying to achieve? The key in that question is that you must first know what you're trying to achieve. The second piece is having a solid workforce development strategy. Who is your workforce? Who will be your workforce? And perhaps most importantly, what supports will that workforce need to be successful? The third piece is occupational regulation. Now, many places have started right off with certification or some type of credential. They've jumped right in. So they're dealing with legislation and complicated questions before they've even dealt with those first 2 pieces that I've put before you. But occupational regulation has to be a part of the discussion. Why? Because you must understand what your quality controls will be for your workforce. You must also understand what the liability concerns will be for not only you as a workforce, but your employers. So you must have the conversation and you must think of a way to jointly move forward around occupational regulations of some sort. And there are many, many choices on that spectrum. And then the fourth is the ability to have and capture some level of standardized research and evaluation. Why? Because you must know. How will you know, should I say, how will you know when you will reach success? What do you know works and what do you know does not work so well? How will you know when you've hit the mark? So having partners that are able and available and willing to walk the path with you to be able to research and measure and evaluate what you are doing pours back into you the information that you need to continue to refine your path as you walk it. The work that has been done here and accomplished and that's noted in the documents in your folder clearly say that you're capturing many pieces of those 4 buckets. So you are well on your way. And it's significant that you can be able to look back and say that, because then you have a strong foundation to stand upon. But the strategy does not and must not stop there with those 4 buckets. Undergirding those 4 pieces, I think you really should consider 4 core principles to sustain those buckets. And I guess today 4s are a magic number for me somehow. But first, let me say that the first undergirding principle really should be your focus on promoting and supporting full participation and leadership of community health workers in all policy development. No questions asked. You must, and I'm speaking directly to the community health workers, you must be at the table. Your involvement is essential and critical. Second, undergirding those 4 buckets is a caution. In our zeal to create a new system that embraces the workforce, let us be mindful not to create barriers. Let's think about how we minimize barriers for the workforce, particularly in areas of training, language, educational level, life experience, and citizenship. Many places have stumbled because of these. For example, in Texas, a leader out there in certification that jumped in early and tried to make it happen. And somebody's got to start, which means somebody's going to stumble first, and somebody's going to have to pick themselves up and dust themselves off. So being first out there and stumbling a little bit isn't a bad thing. But understanding where they stumbled for you is so important. Texas stumbled because they had unintended consequences that worked against them by having high barriers or significant barriers in obtaining the certification credential that they chose. This inhibited their ability to achieve the ultimate goals of the workforce. They are now working very hard to correct those things. Texas is a huge state, so they had a lot of things to overcome. But be mindful not to create more barriers as unintended consequences. Third, you must engage the provider and business communities from the beginning. And most importantly, you must keep them at the table for the long haul. Business is business, and the focus is often on results. For business, time is money. Feel-good conversations are good, but our healthcare now is often about the business of healthcare. So time equals money. How do you keep your business partners engaged through this process as you aim to move forward and achieve your goals? Being in this investment for the long term is key. It will take time, it will take patience, it will take innovation and creativity, and to a large degree, it's going to take risk on everyone's part, but particularly on the business community's part, on the providers' parts, and on the insurers' parts. We must recognize that this is an uncharted territory for them, and so there is some risk. But for me, my question to them is always, are you willing to take the risk? Or perhaps even more poignantly, are you willing to fail? And if you are willing to fail, perhaps it's even more critical that I have your commitment and willingness to learn from those failures and to stay in the game with me until I get it right. That is a true commitment of the business partnership here. You must know that this is a long-term investment and that staying in the game and working through the risks and the tough turns will be so important on the long run for the outcomes. And then finally, fourth, How do you maximize the tremendous gifts and talents of this CHW workforce? You must think about a way to incorporate a full range of CHW roles and competencies in the CHW positions that are created that will allow for and recognize that the community health worker model is indeed a very much a model that is social. It is a social one that is rooted in culture and traditions that can bridge the health and human service systems and ultimately increase the quality of one's life. How do you create a system that embraces those things that are always not so easy to measure? Now, I want to be inspiring, and I want to put all that out for you, but I also want to do my duty here to be real. I am tremendously excited about what's happening, and I'm tremendously excited about how far you have come over these years. But there is a lot of work still to be done. And when I go out and I talk to people about how far we've come, we feel so good, and then I get to this point and I say, but wait, there's a lot of work yet to be done. And I often use the example of how those of us who worked for the last few years on health reform and worked so hard to get it accomplished and get it all done, and once the bill was signed, we kind of said, phew, but then we said, wow, there is a lot of work to be done to make this happen. So catch your breath, take a pause, change your game shoes, and get back out there. And that's really the message now. You have accomplished so much over the last few years. And I feel like now my new role as I talk to people is like, CHW coach. And I have to be this coach, right? I got to cheer you on and tell you and give you the tools and be there for you and help you, but be realistic to tell you, you know what, we're just at halftime. That whistle wasn't the end of the game. Let's come on over to the bench and catch our breath. This is just halftime. We've practiced, we've done our homework, we've read all the articles, we know who the players are, we've had numerous conversations, and we have been given some tremendous calls by the passage of the Affordable Care Act. The timing for you is unprecedented. We are no longer doing business as usual in our healthcare system. There is room for and tremendous incentives for innovation and creativity in ways that there have never been before. There's innovation in payment and delivery systems. Prevention is a key focus, and intervention that prevents illness is actually being rewarded. Whoa, let's think about how long we fought for that, right? Think about the work that you as community health workers do on the front line on prevention every day, and now it's being rewarded. We have to get back out there and work hard to make it happen for us, for you. Medical homes, health homes, accountable care organizations, decreasing hospital readmissions, Medicaid redesign and cost reductions, some of these things you're going to hear about today. The list of opportunities for the workforce goes on and on and on. For those of you who are community health workers, my message for you today can really be summed up in 3 simple words. Seize the day. Now, for those of you who might be a little familiar with those 3 words, you also know that their Latin phrase is carpe diem, which means seize the day. So as I was thinking about how we bridge this feeling of how excited we are with the energy to move forward, I began to think about the power in those 3 words. So I, did what everybody does. I go and Google it, and I see what comes up, right? Google it, you get some answers. And I go to what my my kids don't really believe actually ever existed, a hard dictionary, the actual thing, the paper, and that you don't put in dictionary.com and find the definition. But it was a quite interesting search. I found that carpe diem has also been translated to mean to seize a certain moment in time, to make the most out of a part in time. And perhaps for me, the most striking definition I came upon was a translation that said to put aside all differences, all fears, all worries, and just go for it. And I thought, that's it. That's my message. You see, what I want you to know is that today is your day. This is your time, not only to seize the opportunity to engage and to be involved in the topics of the agenda today, but to seize the day of your future, of the future of your profession in this state and across this country. There's no longer a time to sit and be still, to be silent, or to observe from the sidelines. Because as long as there's even one uninsured child, you must seize the day. For as long as the number of children enrolled in Medicaid and in need of services continues to grow, you must seize the day. As long as infant mortality rates for some minority children in this country are almost twice that of the white population, we must seize the day. As long as every day in this country, on average, 2 mothers die in childbirth, and over 2,500 kids are born into poverty, we all must seize the day. So where am I going with this? As I said, there is a lot of work to be done. In this great state, in this great country, and at this great time, community health workers can make a huge difference. For the community health workers in this room, I know that policy and legislative issues can feel big and very complicated. And in reality, they are. But you're community health workers. Big, hard, complicated things never stopped you before, so don't let this stop you now. Your voice is needed now more than ever. Now that I've told you halftime is over and that it's time to catch your breath and get back out there, you might say, okay, coach, but then what does that mean? What do we do? What have I learned? 3 things that I want to leave you with that I've learned. I should have thought of a 4th one. I was on 4. I was on a roll, right? 3 things. But these 3 things come from reflections of working with people across the country who are trying to figure this out. So the first thing is find your purpose. Today in these discussions, as you leave out of here, think about what is your purpose? Where is your place as this initiative goes forward? Particularly for those of you who are community health workers, given where you are individually, given your circumstances, whatever your work commitments are, what role is best for you? You see, there is a role for everyone, no matter how big or how small. There is much work to be done. Whether you have an hour or 10 hours to give, your voice is important and it's needed. There's a lot at stake out there, and there's a lot of groups that will be meeting and working together. Community health workers, the business sector, political sectors, government sectors, providers, insurers, all have a place at the table in order for this to happen here. This effort includes everyone. Find your purpose, find your place at the table. But for you as CHWs, your involvement is particularly important in fulfilling the purposes and the goals stated forth there by the initiative. The second thing is, don't dwell on the past. Respect it, put it in perspective, learn from it, even leverage it. Build upon it, but don't get stuck in it. Too often we get tired because we're so busy looking back behind us. This is indeed a journey, not a race for the swift, but a journey. It's going to be an endurance test of sorts. There will be hard choices, tough decisions, stalls, disagreements, I might even say, but engage these things with a forward-looking focus. For example, have you ever tried to walk or run by looking backwards? It's hard, right? When you're looking backwards and trying to run forward, you stumble. You even are using different muscles, and you don't get as far as you need to get, right? You have to use muscles in your neck and your head and your shoulders. I'm sure other things. Doctors in the room, please help me. Community health workers, tell me what muscles these are. But you can't get that far quickly by looking backwards, right? It takes a lot of energy. You get distracted. You might even trip or stumble. I think it's hard for people to do, but it's important at times like this to stay focused forward. You run the risk of one of two things happening. You either get caught up in how far you've come, looking back saying, woo, I was way back there and look at where I am now. So you get a little complacent and you don't move as quickly, or you don't move as agilely, or you get a little comfortable, and that could lead to a bit of complacency. But then, if you keep going slowly, you kind of at some point come to a little bit of a standstill, but you can't stop. We can't get comfortable. Or you get so overwhelmed by what it took just to get as far as you are today that you get tired. You often begin to say, as his surgeon says, oh boy, I've been working all this time and this is just how far I've come. Those of you who are on, exercise regimens, and you walk on a treadmill and it's like, oh, half an hour, I've only run, how much? Don't pay attention to the meter. Keep moving. Or you begin to say, oh, been there, done that, heard that before, was back there 5 years ago, no need to do that, no need to go to that meeting. No, stay focused forward. The past is the past. You must recognize it, you must know it, but dwelling on the past will distort your vision for your future. This is a new and improved course, a whole new half to run, and you must stay focused forward. I also want to pause here to say that part of this moving forward is moving beyond the not so good feelings, and that might be an elephant in the room. There are relationships along the way in trying to teach people about the work of community health workers and have people invest in community health worker workforces and the research and all of those things that may have not been the best experiences. But this effort is going to take tremendous collaboration and unprecedented partnerships. The stakes are high for all involved. People who wouldn't, couldn't, or might never have imagined working together will find themselves working together now. The political and economic landscape of healthcare and the healthcare delivery systems will demand it. Leave the door open for creative, innovative collaboration at all levels, local, regional, statewide, and even across state lines. And this brings me to the third and final point. Face the present. Look at what tremendous opportunities lie ahead. We are at an apex in time like no other for community health workers in the community health worker workforce. There is a recognition at the federal level, unprecedented inclusion in federal health care reform efforts, and conversations taking place throughout the Federal Department of Health and Human Services and other agencies like HUD and Labor. This is unprecedented. Likewise, states' activities are picking up. Look at what's happening here. The pace is picking up tremendously. Now, you know, you may not feel it, but New York is actually very much a leader in this area. You have worked hard, and you're here in the state, and I go other places, and I hear them asking me, well, tell me how they're doing it in New York. Because the partnerships that you all have created, and the collaborations, and the investment in you all as a workforce is groundbreaking and tremendous. These are barriers that other people are trying to figure out how to overcome in their states. So you are doing tremendous work. This is the future of your profession, and it's a profession filled with uncharted and untested waters. And the most exciting thing is that you get to play a major role in designing it. I bet many of you never thought that you would have that opportunity. By actively seizing this moment in time, you are shaping your future and the futures of all who come behind you. This is your defining moment, and in some ways, this is your civil rights moment. You have the opportunity like no other. We have no choice but to act. You must seize the day, this time, put aside all differences, as I said, all fears, all worries, and go for it. Now, I know some of you may find that perplexing and think about, how do I do all this and make it work? You can do it by doing it together. So as I close, I just want to share with you this very brief story, because I also think you have to do it with laughter and you have to do it with a smile, because that's what energizes you. So here's my little story for you as I leave you. A young soldier and his commanding officer got on a train together. The only available seats were across from an attractive young woman who was traveling with her grandmother. As they engaged in pleasant conversation, the soldier and the young woman kept eyeing each other. There was clearly an attraction there, and it was obviously mutual. Suddenly, the train went dark. It went in a tunnel and slowed down. It became pitch black. Immediately, two sounds were heard: the smack of a kiss and the whack of a slap across the face. The grandmother thought, I can't believe he kissed my granddaughter. But I sure am glad she gave him a slap. He deserved it. The commanding officer thought, I don't blame the boy for kissing that cute little girl, but it sure is a shame that she smacked him so hard. The young girl thought, that was so nice. I'm glad he kissed me. But I wish my grandmother hadn't slapped him so hard. And as the train broke into the sunlight and came out of the tunnel, the soldier could do nothing to keep that smile off his face. You see, he had just seized the opportunity to kiss a pretty girl and to slap his commanding officer, and had gotten away with both of them. For the community health workers in the room, this is your time to be that soldier. You got to seize this opportunity, go for it by grabbing all the information you can today, then jump into your future, push the envelope, ask the tough questions, make your needs and requests known. You are community health workers. I know you know how to use your voice to get things done. It's time to use it for yourselves. And you just might find out as you emerge on the other side of the tunnel that you have achieved more than you could have ever imagined or dreamed. Have a wonderful day and good luck in all of your efforts.